Another day, another cup of coffee, maybe two, a little more chaos to sprinkle in, right? So what's on the topic of today? Well, it's RFK, but I'm going to talk about something else first. First, actually, let me talk about my robe. This robe is very old, but it's a chilly morning, and this is like that robe that's that perfect pair of jeans that's just been used just the perfect amount of times and washed, or that T-shirt. This is that robe, so I'm not getting rid of this baby. But let's talk about RFK. How is this going to cost you money? Well, first, let's go back to the Consumer Financial Protection Bureau. Corporations hate that organization. It's basically gone, right? Now, RFK, who's uniquely unqualified for the position of Secretary of Health, anti vaxxer, doesn't matter what he says. Doge was at the IRS over the last few days, so you can expect more cuts there, as the government has already said there's going to be massive firings with probationary federal employees. But Secretary of Health, Republicans are pushing, it's part of their budget, to do major slashes to Medicare and Medicaid. This affects 150 million of us. That could hurt our pocketbooks one way or another, right? We've already seen the price of eggs going up, groceries going up, everything's going up. These tariffs are coming into play now. It's what I keep saying. You need to be prepared financially for all this. But what about RFK? First place, how he got $1 million in credit card debt, which was being reported. I had no idea that was even possible. Maybe he should call me for bankruptcy. But as Secretary of Health, now there might be some good things, right? A push to work harder on eliminating or reducing processed foods and certain chemicals that we put in our food. So I don't think anybody has a problem with that. Um, at his confirmation hearing, it was clear he didn't know the difference between Medicare and Medicaid. But my concern is your pocketbook. If he's anti-vaxxer, if he's going to start getting, look up what he had said about COVID. I had COVID last September. I was just getting out of COVID, and the hurricane hit 2 days later. September of last year was not fun. It was like a whole month just disappeared. But COVID hit me hard, and I stopped taking the vaccine. What was it, 24? Maybe end of 2022 was the last time. So 2023, nothing, and then 2024. I mean, it was bad, 103 fever. So, you know, COVID is real. I don't care what anybody says. I don't care where it was created. All I know is that it exists, and we need to have vaccines for that. So if he's anti-vaxxer, which, by the way, I already woke up this morning and said maybe I should go ahead and try to get my COVID shot in next week. All these government programs, like paying for your COVID shots, if that gets eliminated and you get sick, what do you do now financially? Do you know how much it costs to go to the hospital for 5 days and get pumped full of IVs and all these meds that they're going to give you because you have COVID? Can you afford that? Probably not. And you know why I know that? Because the number one reason people file for bankruptcy is medical bills. Number two, health related, right? You miss work for a week or two, you fall behind on your bills, etc. Now, I don't know how long I was knocked out of the game. There were like 3 rough days where I wasn't working. And if I'm not working, I'm not making money. I don't work for, corporate America. I can't, take PTO and I'm still going to get paid. None of that applies to me. So me missing work, my schedule is very rigid because I know when I can and cannot miss work. Now, if you get cut Medicare or Medicaid, whatever benefits you receive, who knows whatever other, you know, sort of benefits are on the chopping block. But now you get sick, right? And the cost of healthcare, which is ridiculous. Nobody can afford it. Thank God for Obamacare. A lot of people have been able to benefit from that. But if you get sick and there's no vaccines available and you don't have health insurance, then what's your next move? Unfortunately, it's bankruptcy because, like I said, it's the number one reason people file for bankruptcy is because of medical bills. It's not buying fancy cars and big screen TVs. Yeah, that there's some of that, of course, but it's not the number one reason. So all I can tell you is look around you, right? You have massive layoffs at the federal government. You have departments completely disappearing, right? You have tariffs. You have cuts to Medicare and Medicaid. You might not be able to get access to certain things, certain vaccines now, whether you and your kids. Add this all up together and tell me where you're going to make more money off of this. How this is saving you money. It's not. It's going to put you in more debt. Now, to close, I have been predicting since COVID that bankruptcies were going to rise 2024, 2025. And it has been consistently rising since 22 and 23 and 24. And we'll see what happens now. Why? Because the statute of limitations, which is when a creditor can file a lawsuit against you, if they don't do it within that time period, your case should get dismissed. That time expires for most states at 4 years. Some states have 2 years, some have 6 or 8, but let's say generally speaking, 4 to 5 years is when a lawsuit has to be filed. COVID was 2024. 2020. This is now 2025. This is basically the last year that creditors will have to file lawsuits to collect on all those credit cards that weren't being paid during that time. So I do expect an increase, but now I expect even more of an increase because of this. So, the vaccines, Medicaid, etc. So just be prepared financially. That has been my message consistently throughout my blogs, my videos, and everything else. All right. So take care, stay healthy. Okay, I don't care what they do with processed foods and everything. At the end of the day, it's all about diet and exercise. So do take care of yourself. All right. Take care. Enjoy that cup of coffee. I know I'm going to. Bye bye.